Hi, welcome back to part 2 of HIV and AIDS. We left off at diagnostic tests, so we will pick up there. In your outline just before that is collaboration. It's important that we collaborate with our interprofessional team because it's just so important because these patients need a wide variety of help. So we have our healthcare providers, we need specialists in HIV or AIDS or infectious disease, pharmacy certainly because they are going to be on multiple medications, dietitian because nutrition is an issue. They may need RT-PT-OT, especially if they are having cognitive issues or end up with PJP pneumonia. Case managers, social workers, they'll need some financial help, certainly lots of resources. They may need spiritual care and professional counseling. So this affects all aspects of their life. So let's look at diagnostic tests. So your book talks about a ton of different types of HIV testing, why we want one over the other. There is a really quick test that you can get, probably not very accurate. My job as the nurse is not to determine which test is appropriate for the patient. It's to administer the test and then know what to do when we get those results. These results really should be given to the individuals by their healthcare provider. We will come in and follow up with that and need to talk to them and provide them education. And we're going to need to do this beyond the first time of here's your test results. We're going to have to do that repeatedly with them. So the tests are really detecting the HIV antibodies. So what's important for us as nurses is helping the patient understand how these results are interpreted. So a positive test means that you have antibodies to the HIV are present in your blood and that you have been infected. The HIV is active and the individual can transmit the virus to others. So that is so important. It doesn't mean that they have AIDS. The patient may still be in early stages. They could be in the later stages, have just actually ignored all of these or had a rapid progression, and that CD4 count will tell us if they're in AIDS, but it just doesn't mean that they're AIDS. So we do need to explain to people the difference between HIV and AIDS. Those antibodies don't mean that they're immune. Now, a negative test, what this means is that there was no antibodies detected. That could mean that you're not infected, but it could also mean that you were recently infected and the individual's body hasn't made antibodies yet, because remember, those start between 6 weeks to 6 months. So what that means is the individual needs to continue to use precautions. Doesn't guarantee that they aren't infected and that they aren't passing on the HIV virus. They do need follow-up testing to see if they convert, if we detect those HIV antibodies and they become HIV positive, and especially if they are having risky behaviors. So it's important to note that these tests are confidential and we need to give them support. It's nobody's business. When you're giving bedside report, if we have HIV testing for this patient, that would be something that we would need to ask the patient themselves. If you have family here, when we come to give report, do you want us to talk about your test results in front of your family? Up to them, but very confidential. There's a lot of stigma to being HIV positive. Certainly when it was first detected in the 70s and early 80s when we didn't know about it, but I think that still is there. I think it's better. People are more understanding of what this is, but there's still a lot of stigma to this, and it just affects all aspects of their life. Education and counseling are vital for prevention and emotional support. A positive result can cause panic, depression, fear, and hopelessness. The individual can face social stigma, job loss, or relationship issues. They could lose their job. Losing their job based on their HIV status is illegal. You can't, that's part of you can't discriminate people for that, but those things can happen. They can lose, have relationship issues, end up losing their house. It just affects all parts of their life. So monitoring their HIV progression is really important, and we're going to look at two different things. We're going to look at viral load, which measures the amount of HIV in the blood, and we're going to look at the CD4 cell count, which is those helper T helper cells, and that measures the immune system's strength. So what we want is a lower viral load, and that means we have effective antiretrovirus therapy going on. The lower the CD4 count, the weaker their immune system is. So what we really want is a lower viral load and a high CD4 count. So I went and looked at CDC, which led me to the WHO, World Health Organization website that did have three categories of viral load. And the first one is considered a viral load between 20 and 50 copies per mil, and that's actually considered none detected, because previous to these very specific tests that we have now, we wouldn't be able to have picked up these HIV antibodies in their blood. So if you're less than 50, that is really considered non-detected, and this is where we want everybody to be with their ART therapy. There's no risk of transmission to your sexual partner and minimal risk of mother-to-child transmission. So this is really where we want everybody. If our viral load is less than or equal to 1,000, so greater than 500 up to 1,000, it does mean that we're suppressed. So we are suppressing that viral load, but we're not where we need to be. Some virus is replicating and present, and there is risk of transmitting to your sexual partner or through contact with these patients. If your viral load is greater than 1,000, you are considered unsuppressed. You're at increased risk for falling ill and passing the virus on to sexual partners or children. So let's talk about a CD4 count. As I said, it's used to monitor progression of the disease and helps to guide therapy decisions, and they're really checked every 3 to 6 months. So varies with a normal CD4 count. The 450 to 1100 seems to be pretty standard, and really a count higher than 1,000 is considered normal. If your CD4 count is less than 500, you have manifestations of immunosuppression, which means that HIV is really taking a toll on your immune system. If you have a CD4 count less than 200, that is one definition of AIDS, and opportunistic infections and cancers are likely. And you can even have CD4 counts less than 500. Other tests we may do, a CBC, certainly their white count will be low. We may need to do TB testing, MRI to look for infections in other parts of the body, and cultures for opportunistic infections, and certainly those Pap smears. All right, let's talk about pharmacology. You do have meds in Table 8-1. I've summarized what you need to know. There are antiretroviral therapy, so ART therapy, and then there's 4 categories under that of specific medications. As the nurse, I'm going to administer meds, and I need to understand what those medications do, and I need to educate my patient appropriately for that. I am not the one picking the types of medications, so we're going to take kind of an overall view. So the reasons we use these medications, number one, is to suppress HIV therapy. This list actually reads differently from your book. As I said, I looked at several sources, mainly CDC and WHO, and a couple of other med-surg books, and kind of combined this because I found that this just was easier to understand and made sense. I think our book is kind of hard to understand actually in this chapter. So we want to suppress the HIV by preventing the virus from replicating, thereby reducing viral load. So if a viral load is low and the CD4 count is high, that tells us our ART is working. We want to restore immune function by reducing that viral load. So that's what ART helps to do, and helps that immune system recover and function more effectively, reducing the risk for opportunistic infections. Reduce the risk of transmission. When that viral load is suppressed to undetectable levels. Individuals with HIV cannot transmit the virus to others. And this is the big piece of where we've seen changes and real strides for improvement for HIV. There's no immunization against it, but these meds are allowing these patients to be undetectable, which means they can't infect other people. So this is fantastic. And we're going to prolong life and improve quality of life. ART allows individuals with HIV to live longer, healthier lives and slow the progression to AIDS. So there's multiple ART meds that are used. Many have combination therapies are available, but I will tell you that these medications are expensive and they have lots of side effects, and those may be two big reasons we have non-adherence. So it's important that we talk about and the patients understand the importance of adhering to the treatment regime. Crucial to suppress the virus and preventing the development of drug resistance. If viral loads are not suppressed, it may indicate non-adherence to the treatment plan. So see why we have to have these conversations every time the individual comes in. Factors that affect non-adherence: knowledge and understanding of the treatment plan, access to medications, side effects, and psychosocial issues. So there's our interprofessional team members, and you should be thinking about all the things that you can do to help these individuals. Education and counseling: use interprofessional team approach, assess readiness to start ART, assess adherence to at every visit, provide positive reinforcement to foster success, identify the types of and reasons for non-adherence, and provide necessary resources and information. I'd probably put a big old gold star on that. That is certainly things that we can do. Common side effects from these medications: GI issues, nausea, vomiting, diarrhea, abdominal pain. Some meds you take on an empty stomach. Sometimes it doesn't matter. Sometimes you need to take it with medication. So see why the pharmacist is so important to us. Fatigue, weakness, malaise, general feelings of being unwell. They can have skin rashes, itching, changes in skin pigmentation. So that's distressing. Metabolic changes, their cholesterol levels, blood sugar levels, body fat distributions will all change. So their cholesterol levels are going to go up, blood sugars can go up. They can have a change of their body size and shape, and that's distressing. Headaches, insomnia, changes in mood and behavior. So those are all important. Non-pharmacological therapies. So it's important to provide preventative education to individuals who are high risk in the community and involve interprofessional team members. And I spoke of that really in the first recording. Collaborate with child care directors, teachers, schools, and camps if they will be having a child attend that is HIV positive, and how to work with those. So we really shouldn't have to be doing that. HIV's been around long enough, but here's some information on that. Use standard precautions. Procedures for notification when a child has an infectious disease, and limit contact of the child with HIV to that because they are immunosuppressed. So we need to think about those kinds of things. Complementary health approaches can decrease side effects of certain medication treatments and increase comfort. All individuals with HIV and AIDS should consult with their healthcare provider before beginning any complementary therapy, specifically using garlic and St. John's worts. Those things should not be used. That was on the CDC website of absolutely we need to not use those. The CDC actually has a good website. The homepage, which I linked for you, just has basic information, and then you can click through with all of those specifics. As you're thinking about HIV and AIDS, this is where those clinical manifestations and those tables that I talked to in the book that you need to look at. They can certainly have nausea, vomiting, diarrhea, which means we are going to have issues with nutrition. They're going to have fatigue, weakness, which means we have to help them do ADLs. They need lots of education. If they have a lot of mouth sores and ulcers, we need to give them treat that thrush, and it may be difficult for them to eat and drink. So we need to just work through all of those side effects, skin problems, rashes, what we can do. So when you look at those major side effects, think about what you're going to do as a nurse. So do look at those tables and those broad categories. The book does a good job. Okay, so let's talk about lifespan considerations for HIV. So your book does divide this up into pregnant women, newborns, infant and children, adolescents, and older adults. So let's talk about pregnant women. Transmission. HIV can pass from a HIV positive woman to the baby through the placenta, delivery, or breastfeeding. So treatments, ART meds are safe to take during pregnancy and greatly reduce transmission risk. Having HIV testing done is a routine part of prenatal care. So we should know their HIV status early on, and if they are positive and are not on antiretroviral therapy, we need to start that. That is fine to start that. If they are currently on ART therapy, they need to continue that. If the woman is in a high-risk category, that initial HIV testing done early on should be repeated in the 3rd trimester so that we know what that status is. We also need to screen for STIs, TB, cervical cancers. They need vaccinations for pneumonia, influenza, hepatitis. We need to monitor them for anemia, leukopenia, thrombocytopenia, and complications like fever, weight loss, and infections. And those are certainly, those 3 are in the 2nd and 3rd trimester. So routine monitoring, just know that these women can have anemia, leukopenia, and thrombocytopenia. Women who are HIV positive are considered to have high-risk pregnancies. They should have a scheduled C-section at about 38 weeks before rupture of membranes if that viral load is high. We do need to watch for postpartum complications like hemorrhage, infection, and poor wound healing. So in that immediate postpartum and afterwards. Okay, so let's talk about the newborn. All infants with HIV positive mothers should get prophylactic ART treatment to prevent infection. We will start the PJP pneumonia prophylaxis early, and early testing and identification are crucial due to rapid disease progression in infants. Remember, we're going to use standard precautions for all infants because we won't know their status until after they leave the hospital. Infants and children with HIV. These babies and infants are often premature. They have low birth weights. They may show signs within 2 to 3 months. They will have failure to thrive, weight loss, diarrhea, fever, eczema, enlarged organs. So think about how we're going to treat these patients and the education that we need to give to their families. They are at risk for opportunistic infections like PJP, CMV, and Kaposi sarcoma, and malignancies can occur as well. They can develop HIV encephalopathy, so think of that same type encephalopathy that we discussed earlier in AIDS. They'll have delayed development, loss of motor skill, and they will lose motor skills they've had previously. They do need all their childhood vaccinations, and it's important that we encourage family bonding with these HIV babies, and it's not spread through routine care. So it's important that families bond with these babies. So let's talk about adolescents. They do make up the largest percentage of HIV infected pediatric group, and some of that is children are growing into adolescence and living longer. This group is challenging, which I think is just a blanket statement for most adolescents. It's They have a lot of denial. They have fear about their HIV infection. They have adherence to medical regime. They've got low self-esteem. They may get a lot of misinformation. They can have unstructured and chaotic lifestyle, lack of family and social support, and certainly the risk factors that we talked about. So these can be challenging. So HIV in older adults, we kind of already talked about this. They don't understand the risks of HIV, may not be aware of the importance of getting tested for HIV. Manifestations of HIV may be overlooked by healthcare professionals, being attributed to normal age-related changes or masked by other chronic diseases, and not thinking that these patients might have HIV. So also is a category of patients that we do see increasing STIs in, and we need to realize that our older adult individuals are out there having sexual encounters. Because of polypharmacy, the older adult is at greatest risk for drug-to-drug interactions when starting ART, so it will be very important that we have good contact with our pharmacists. All right, that ends our recording of HIV. Thanks.